Welcome to the Eau Claire City County Health Department. Our mission as a public health department is to promote the health and safety for all of Eau Claire's communities. Broadly, we protect the health of our population by reducing the risk of injury and illness. But what exactly is public health? While a doctor treats people who are sick, those of us in public health prevent people from getting sick and injured in the first place. Clinical care is not the only thing that impacts the health of a community. In fact, our health behaviors, physical environment, and many socioeconomic factors impact our health much more. By providing quality, evidence-based services to the public and promoting healthy behaviors, we ensure healthier lives for all Eau Claire residents. Which brings us to one of our guiding principles, health equity. If health is equitable, everyone has a fair opportunity to be healthy. Unfortunately, unfair differences exist everywhere and often keep individuals from reaching their full health potential. Our staff works with many community members, agencies, and organizations to design programs that take these unfair differences into consideration. When we account for these unfair differences, we can keep much more of our county healthy. Health equity is just one of our 7 guiding principles. We acknowledge that the prevention of disease, injury, and disability is crucial in saving lives and money. It is also critical that we collaborate with our community to design high-quality programs and services. Our decisions and recommendations are based on data and evidence to ensure that our work is productive and efficient. All of our divisions utilize these principles to hold their work to high standards and create a healthier Eau Claire County. Now that you have an idea of what guides all of our work, let's jump into each of our divisions. These 8 teams of dedicated staff are what make our work possible in Eau Claire.
When disease outbreaks occur, the Communicable Disease Division is the first to respond. We prevent the spread of disease like measles, influenza, hepatitis, cholera, and chickenpox by promoting and offering vaccinations, investigating disease outbreaks, and informing the community of disease sources. We partner with healthcare providers to investigate over 1,000 communicable disease cases each year and perform even more vaccinations. Our division is also responsible for preparing for and responding to public health emergencies such as floods, extreme weather, and disease outbreaks. To effectively lower the impact of disease and emergencies, we work with many agencies, including county emergency management, police, fire, healthcare providers, schools, and more.
Our Clinical Services Division believes that reproductive health care is essential for health and well-being. We're here to help provide access to high-quality, confidential reproductive health care for everyone. Our clinical staff is dedicated to providing knowledge and awareness of safer sex practices to reduce the spread of sexually transmitted infections like chlamydia, syphilis, and gonorrhea in our community. Our reproductive health services include birth control, pregnancy testing, annual visits, STI testing, and treatment. We want everyone to feel safe and confident about their reproductive health.
Every community has unique health priorities, needs, and resources. Somebody needs to mobilize these resources, and that's the Community Health Promotion Division. We provide the spark for the fire. After community health priorities are identified, we work on improving health outcomes related to those priorities. By improving those health priorities, we cut down on unnecessary illness, injury, and death. Regardless if our community is lacking access to oral health care, mental illness treatment options, suicide prevention skills, or knowledge of safe infant care, we work closely with our community to find and implement evidence-based solutions to its concerns.
We at the Health Department want to keep all people healthy and safe, and good health starts early, even before birth. The staff in the Healthy Beginnings Division does everything it can to promote healthy families and childhoods. We provide home visiting and nutrition counseling to pregnant mothers and their young children, and screen children for lead poisoning and illness, but our care goes much deeper. We positively transform the lives of babies, mothers, and families by connecting them to the community and resources that they need. By safeguarding the health of parents and their children, we are improving the lives of generations to come.
Public health focuses on improving the health and safety of where we live, work, and play. Another word for that, our environment. The Environmental Sciences Division keeps Eau Claire's natural and man-made environments safe to use and notifies the community when they aren't. Our programs and services ensure that Eau Claire's outdoor recreation areas, such as pools, parks, and lakes, are safe to use, that water sources are safe to drink from, and that the design of our cities promotes healthy lifestyles and decreases risk of injury. Our laboratory investigates potential rabies bites and monitors ticks and mosquitoes for diseases such as Lyme disease. We also work with government agencies, conservation organizations, and community members to develop public policy, rules, laws, and ordinances that increase the health and safety of our environment.
We take a look at our environment through another lens, too. Even the places where we eat and sleep have the potential to spread disease or put us in harm's way. The Regulation and Licensing Division outlines health and safety standards for facilities that provides necessities such as food, water, and shelter. Some of those facilities include campgrounds, hotels, restaurants, food trucks, and housing. Our housing inspection program is quite unique, but there's a lot of evidence to show that housing conditions impact the health of our residents. It's part of our duty to regularly inspect these facilities to hold them to health standards. The codes which we enforce prevent foodborne illness and injury within our homes, keeping our communities safe.
Every health department needs a strong structure and voice. That's where we come in, the Policy and Systems Division. We make sure that our department is accredited by the Public Health Accreditation Board, ensuring that we are constantly improving the efficiency and the structure of our department. We also develop plans with organizations outside of our department. These plans help us, other community organizations, and community members to consistently respond to the needs of Eau Claire County. Lastly, we support our other divisions to use data and communicate with the community, keeping the health department firing on all cylinders.
All of this is public health. Our staff works hard to prevent disease from spreading within our community and to ensure that everyone has an equal opportunity to be healthy. From vaccinations to STD prevention, safe homes to safe restaurants, safe beaches to emergency preparation, and mental health awareness to healthy child development, we are here to promote the health and safety of all Eau Claire's communities. Now that's a lot of work. So you might ask, why do we do it? Because we believe that everyone should have an equal opportunity to be healthy. By keeping our communities healthy, we can live longer, happier lives. What's your why?